Okay, we're here with Hooper again. We're going to do a physical exam on him. He's a pretty tired pooch right now, but otherwise okay. So whenever you do a physical exam, you want to always start with kind of hands-off general assessment to get his mood, his overall walking ability, to see if there's anything slightly unusual for him. So looking at him, you can see he's perfectly symmetrical, good boy. And he was walking over here. He was looking just fine. He's tired now, but he was really bright and happy earlier today. And then as we start with the physical exam, we got his weight coming in here. There's a lot of animals in the lobby right now, so we did weigh him. He weighs 67 pounds. He's a hefty dog, but he's a good runner, and he's got a good overall weight. You can see his shape is very nice. So that's good. So next thing I'm going to check is I'm going to start with the head, and I'm going to do capillary refill time, and I'm going to look at his mucous membranes. So capillary refill time, just going to get up to his gums. He's got nice dark gums. Press on it, and then I'm going to count the seconds it takes back to get to his normal color. So it went from white to red in about a second. He does have very dark gums. Looking at his membranes just around the teeth, they're nice and moist and pink. So he's in good shape, no signs of dehydration. If they were dry or tacky, then he might be dehydrated. But they're pink. If they were white or if they were pale, then you might be looking at some type of maybe anemia or any indication of even heart things. It's very much up to the vet, so I would definitely make sure that he or she knew what was going on if he was pale. The next thing we're going to do is we're going to get a heart rate. So what we're going to do is I'm going to put my palm on the left side, and I'm going to count 15 seconds. And then you can double that, or I'm sorry, times that by 4. If you're in a hurry, in a really big hurry, you could do 6 seconds and then just times it by 10. We don't recommend that, but that's just on a case-by-case basis. His heart rate's really good. It's normal, steady heart rate. And then the next thing we want to do is we want to check the heart rate and if it matches up with the femoral pulse, which is back here. So to get the femoral pulse, as I put these on correctly. So I'm going to feel the back femoral pulse. So I can feel it on my left fingers, and I can hear the heartbeat. And you want to make sure that they match, which they do. Good job, Hooper. So after I do that, I'm going to start, I need to take a temperature. So I have my temperature by thermometer here on the table. So it's got lube on the end already. I'm going to lift up his tail. I know, buddy, I'm sorry. And we're just going to let that go till it beeps. He's at 101.4. Put over here. Alright, so now we're going to start with the head. So what we're going to look at, hi buddy, we're going to look at the eyes. If there's any discharge, if there's any discoloration, making sure when he looks at me, both eyes are looking at me and that they move together. His eyes, if there's any discharge, I would take note of that. Same thing with the nose. His nose is moist and clean. If he had any discharge, especially if it's discolored, I would make note of that, make sure the vet knew. Signs of upper respiratory infection or something like that, if he had a lot of gunk in there, that he looks good. His mouth, we've already looked at his gums earlier. You kind of, if he lets you, get in there, look at his tongue, look at the palate. Good boy. Everything looks symmetrical. I'm sorry, buddy, I'm sorry. Once again, you're looking for discoloration, any lesions, redness. Oh, I really disturbed you. I'm sorry. You might need some water. So, you know, lesions especially, if he was going for a dental, the vet would want to look at all the gums, look for any redness or loose teeth or anything like that. And then we're going to palpate under the jaw for any inflamed lymph nodes, which, no inflamed lymph nodes, of course. Good boy. And then we're going to work down, the ears. The ears, you want to look inside. You can even, if there's if you suspect ear infection, you might even get a bad odor out of the ears. You look for redness, you look for swelling, you see if it bothers him if you touch his ears, which it doesn't. So look inside both. If there's any redness or if it bothers him, he might have an ear infection, so you would need to do a swab and get that cultured with the client's permission. As you work down the neck, you want to palpate for the trachea. If there's any coughing, you want to bring that to the vet's attention. There could be maybe something stuck in there, or maybe you could be irritating the trachea, and so there's something that would make them cough. He seems to be good. And also the top of the neck. And then we're going to start getting down just to the spine. So you would just palpate down the spine to see if anything bothers him. And then while you're doing this, you can even look for any external parasites, any fleas, any ticks along the way as you go down. Good boy. And then as you get to the thorax, this is where you're going to listen for the heart and you're going to listen for the lungs. So I'm going to put this back on. And once again, I'm going to listen on the left side. And you want to listen for heart murmurs. It's a very steady heartbeat. Lots of rhythm to it. I'm listening to the lungs now. And you're just listening to see if there's any, sounds of any, fluid buildup, or if he's having a hard time breathing. And as I'm doing this, I also remembered I did not take his respiratory rate, so take his respiratory rate. You can actually visually watch him breathing and once again count to 15. You can even feel it if they're a shallow breather. If they're panting, and there's nothing you can do about that. But I would feel him or look at him breathing and then count 15 seconds. And he's going very slowly. Well, he's at rest, so if he had like 4 breaths in 15 seconds, that'd be 16 breaths per minute. But I remember to do that. So as you work your way down to the abdomen, I'll get behind him, and we're going to palpate down his ribs, and you want to palpate out. And I'm feeling his stomach, his intestines. I'm basically looking for any enlargements, anything that seems out of place. And I would absolutely bring that to the veterinarian's attention. So you just want to make sure it's smooth. If it causes him pain, you definitely want to make a note of that and tell the vet, because there could be something going on in his GI tract or anything like that. And as you work your way back, you also want to palpate lymph nodes back here. Still, checking some of his hip joints, lymph nodes back here. Everything is symmetrical. You want to inspect anus and genitals. And what you're looking for is, once again, discharge. If they don't want you back by their rear end, maybe, he's feeling pain. There's something going on there. So you want to, look for that. Discharge especially. Then I think, of course, down to the tail. And then what we're also going to do is look for his range of motion. So we'll need to go lateral recumbency. How you doing, bud?
Good boy.
He's at it. So, my partner has him in lateral recumbency. What we're going to do is we're going to check by how far up and then back. And this is checking his joints. And then same thing. He wants to come back. Yeah. I feel like I'm forgetting something. Okay. I think that's all I can remember. So overall, he's pretty chill. Everything seems to be good, working order. And then write everything down on the chart and he should be good to go.